Dr. Pereira years ago. She was actually the youngest covered in Connecticut. She was 16 at the time, and she developed acute anxiety when my in-laws passed away one after the other in their sleep. And she really lost it, and it was really, really sad. And to watch my regular kid just become somebody else that we didn't even recognize was just awful for, you know, for a parent and the whole family. So my mom was actually watching Dr. Oz from far away, and she saw Dr. Pereira treating a young girl much like my daughter. So we called up, we were able to get in. We were really, really lucky that he was in Connecticut and we were in Connecticut. And it was amazing because she wasn't able to be covered immediately. She had anxiety and wouldn't try medication because she was afraid of medication. And part of the prerequisites for being covered were that you try medication. So we took her to the office, and Dr. Pereira had an insurance specialist there that filed an appeal, and we actually won. And it was great, and we won, and she wound up going through the treatments. And now it's 4 years later, she's doing great, she's in college, and so there is hope. There's hope for so many things with this new treatment. We're so excited to be here and having just recently partnered with Dr. Yang and his team to bring new protocols and the fact that TMS is now covered by insurance to Bryn Mawr. So before, you could get TMS, but it wasn't covered all the time. And also, there was only really one protocol for depression. Now, Dr. Pereira has successful protocols between 83 and 90% success rate, especially for PTSD and even anxiety, where they thought, you know, that couldn't happen. So, yeah, so it's exciting, and there's some great things going on. Dr. Pereira is going to join us via Skype, and Dr. Yang is going to say a few words after, actually before or after that. First, I'm just going to show you so you can see what TMS looks like. This actually is my daughter and having a treatment, and the news came to see this with Dr. Pereira. So I'm going to show you that, and then in the back room we have, you're going to meet the staff here, Ellen and Lon and Dr. Yang and Mary. Mary's a treater here, and Nikki is also a treater here, and they are here to help answer any questions as we progress through the night. Dr. Pereira's right-hand man and brother is also here. His name is Trihan Pereira, and also can help to answer any questions that you might have. But what we're going to do now, I'm going to show you this, and then you can actually see a demo of the TMS after Dr. Pereira speaks, which is great to see just how it works. So right now I'm going to play this. And
Dr. Tariq Pereira is a board psychiatrist with an office in Greenwich. Contemporary Care is a full-service psychiatric practice, and he says this office has performed the most TMS therapy treatments in the country.
TMS is where you get a magnetic cord, you put it over your head, and you create a pulse that directly targets the part of the brain that is underactive.
No pain. It literally feels like a finger, like someone's finger is just...
that's
tactical.
Pereira says TMS, or transcranial magnetic stimulation treatment, has been approved by the FDA since 2008, and it is safer to use than a cell phone. During the first appointment, the patient is assessed and then returns 5 days a week for 6 weeks for the treatment. Nerves in the brain are activated by TMS, and eventually the activation becomes permanent, says Pereira.
It works very fast, so people who've been depressed 10, 20 years start feeling better in about 3 weeks and get completely better in about 6 weeks.
Patients who have tried 4 antidepressants with no improvement to their mental state can be approved by most insurances, according to Pereira, who has done research on TMS at Columbia University and is the founding president of the TMS Society. He says about 70% of his patients get well after 1 6-week TMS treatment.
Our goal is to get them to have normal functioning. It's not about making people artificially happy. That's, getting someone high. Where we feel that if you are able to have normal moods and respond appropriately to what's going on, and have normal functioning, normal levels of motivation, that is what we call wellness, and that's our goal. And we get there a lot better and a lot quicker and a lot more safer with TMS than with medications.
Pereira says this treatment can also be helpful to patients who don't want to use medication, like Camry DeCrosta. She was treated at Contemporary Care for anxiety and depression.
Part of my anxiety was health anxiety, so like that made me anxious to take pills. So yeah, I like this because there's no side effects, and pills can give you like a million side effects.
But for patients who do use medication, Pereira says they will continue taking them through TMS treatment. And he says TMS is essentially safe for every person to try, except for those with magnetic metal in their head.
The number of times people have gotten better with TMS and tell me, look, if I didn't get better with this, I'd kill myself, is really scary.
Pereira says TMS can also be used to treat PTSD, OCD, and bipolar depression, but the FDA still needs to approve it for these practices. You can learn more at www.contemporarycare.net. Reporting for the Greenwich Sentinel, I'm Taylor Knight.